for Eating Disorder Awareness Week, I'm going to do a video day about something different to do with eating disorders. Today is just going to be a brief introduction, just going through the DSM-5 about feeding and eating disorders and the specifications. Okay, so there's basically eating disorders and there's feeding disorders. There's anorexia nervosa, bulimia nervosa, binge eating disorder, pica, rumination disorder, avoidant or restrictive food intake disorder, otherwise known as ARFID, other specified or feeding eating disorder, OSFED, this used to be EDNOS, unspecified feeding or eating disorder, UFED. Okay, so to be diagnosed with anorexia nervosa, you have to be persistently restricting your energy intake, leading to a significantly low body weight for your height, your age, your developmental, physical health and everything. It used to be a BMI of 17.5, but I think they've changed that because not everyone gets to that weight, and you can be significantly underweight for your body, even if you're heavier than that, like depending on what your body is like and like your composition. You have to have an intense fear of gaining weight or becoming fat, or persistent behaviour that interferes with weight gain even though you're significantly low weight. A disturbance of the way one's body weight or shape is experienced, undue influence of body shape and weight on self-evaluation, or persistent lack of recognition of the seriousness of the current low body weight. So basically, to have anorexia, you have to be diagnosed with anorexia nervosa, you have to be at a low weight, you have to be scared of gaining weight or like becoming fat, and you kind of deny there's a problem, like you don't really think it's serious. The subtypes of anorexia are restrictive type and binge purge type. Bulimia nervosa, to be diagnosed with that, you have to have recurrent episodes of binge eating, which is discrete usually and in a 2-hour period of time, and you eat an amount of food that is larger than most people would eat in similar circumstances. When you're binging, you also have a lack of control. Recurrent inappropriate compensatory behaviours in order to prevent weight gain. What we normally think of when we talk about bulimia is self-induced vomiting, otherwise known as purging. Like, that's what we think of when we think about purging. Misuse of laxatives, that can count, diuretics, any other medications, like diabulimics, they use their diabetes medication, and fasting or excessive exercise. For binge eating and inappropriate compensatory behaviours both occur. On average, they occur at least once a week for 3 months. Self-evaluation is unduly influenced by body shape and weight. The disturbance does not occur exclusively during episodes of anorexia nervosa. Binge eating disorder is a new one on the eating disorder DSM-5. To have binge eating disorder, the top part is very similar to bulimia. Basically, you have to binge, which is what I said for bulimia. The difference is that these episodes are associated with eating more than normal, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling embarrassed by how much one is eating, feeling disgusted by oneself, depressed or very guilty afterwards. And after this, they don't purge it in any way, shape or form, which is what makes it different to bulimia. Usually, binge eating disorder occurs with people who have other psychological problems, as with anorexia and bulimia. They could have also been through hard times in their childhood or something which could have led to the binge eating. Binge eating has to occur at least once a week for 3 months, and it is not associated with use of inappropriate compensatory behaviours or restriction. Pica, that's another thing. Well, to be diagnosed with pica, you have to have a persistent eating of non-nutritive substances for a period of at least a month. The eating of the substances is inappropriate to the developmental level of the individual. The eating behaviour is not part of a culturally supported or socially normative practice. If occurring in the presence of another mental disorder or a medical condition, it is severe enough to warrant independent clinical attention. And apparently pregnancy classes as a medical condition now. Didn't really class it as a medical condition until now. Pica often occurs with other mental health disorders associated with impaired functioning. Rumination disorder. It's repeated regurgitation of food for a period of at least a month. Regurgitated food may be rechewed, reswallowed, or spit out. The repeated regurgitation is not due to a medical condition. Behaviour does not occur exclusively in the course of anorexia nervosa, bulimia nervosa, binge eating disorder, or avoidant restrictive food intake disorder. If occurring in the presence of another mental disorder, it is severe enough to warrant independent clinical attention. Avoidant restrictive food intake disorder is also known as ARFID. Well, to be diagnosed with this, an eating or feeding disturbance as manifested by the present failure to meet inappropriate nutritional or energy needs associated with significant loss of weight, significant nutritional deficiency, dependence on enteral feeding or oral nutritional supplements, marked interference with psychosocial functioning. The behaviour is not better explained by lack of available food or by an associated culturally sanctioned practice. The behaviour does not occur exclusively during anorexia nervosa or bulimia nervosa, and there is no evidence of disturbance in the way one's body weight or shape is experienced. So they don't see their body differently to what it is, like people with anorexia and bulimia tend to do. But eating disturbance is not attributed to a medical condition or better explained by another mental health disorder. When it does occur in the presence of another condition or disorder, the behaviour exceeds what it is usually associated and warrants clinical attention. Other specified feeding or eating disorder, OS-FED, no one really says this, they just kind of call it EDNOS now, but this is basically, it can, on the DSM-5, it can be atypical anorexia nervosa where all the criteria is met apart from significant weight loss when the weight is within or above the normal range. Binge eating disorder, it's binge eating disorder but a lower frequency or less than 3 months, so they're not binging as much and they haven't been binging it, or they haven't been binging as long. Bulimia, you have to be binging and purging less than is stated on the criteria for bulimia nervosa. Purging disorder, it's purging without the binging. Night eating syndrome is just like eating at night, either after awakening by sleep or by excessive food consumption after the evening meal. Behaviour is not explained by environmental influences or social norms. The behaviour causes significant distress, impairment. The behaviour is not better explained by another mental health disorder, i.e. binge eating disorder. Unspecified feeding or eating disorder, UFED, UFED. This applies to where behaviours cause clinically significant distress or impairment of functioning but do not meet the full criteria for any of the feeding or eating disorder criteria. This category may be used by clinicians where a clinician chooses not to specify which criteria are not met, including presentations where there may be insufficient information to make a more specific diagnosis, for example in emergency room settings. So that is my introduction to eating disorders, and I will see you tomorrow. My video is going to be about pro eating disorders communities. Bye!